and welcome to another episode of the Pawsit podcast. I'm Dr. Sam, and with me, as always, is the amazing Dr. Robert.
Hey guys, welcome back.
And so we kind of decided that we were going to make this our last discussion about the things that your pets get into that are dangerous. So our toxicity podcast series, this is the third one, and we'll kind of wrap it up today just talking about some of the things in our household that everybody has. So some of the medications that you have lying around, maybe even touch a little bit on some of the ones that are more specialized, like prescription medications that people might be on, because a lot of times I get very specific questions about certain ones. I'm sure that Robert does as well. We'll talk a little bit about xylitol because that's a really common one, and then kind of end it all up with some rodenticide or rat poison, just because that's another really, really big one. So those are kind of
Yep.
the last few that we'll get into today.
Yeah, it's because we don't want to bore you guys with all the physiological details. We figure we'll get to
Right.
the
We can explain
important parts.
exactly what happens to the body, but I don't really think you care. You just want to know what to do.
Exactly. So, well,
All
cool.
right. All right. Well, before we get into this, did you have a good day today, Robert?
Did I think? I'm trying to think what I did today. A lot of work for myBalto actually. So,
Good,
trying to.
good.
Oh, didn't.
Yeah.
What about you?
Well, I had a great day, but I had a long day, long day. I was in surgery for many, many hours today, taking stones out of a dog's bladder. So that was
Very tedious process.
yes. Sometimes it comes out in one big stone. Sometimes there's lots of little itty bitty stones, and that was today. So it's
Those are
one
always
of
the
those days.
coolest X-rays to look at, though, and like you feel bad for the dog, but like there's like
Oh yeah.
60 of them there. You're like, it looks like a bag of marbles. I'm like, that sounds. I'm glad I don't have to do that surgery myself. So thank you, Sam, for what you do. But
Well, this was one of those ones that looked, it was very deceiving because when you looked at the first radiograph, I thought, yes, one big stone. This is going to be great. And then actually, when you got in there, it was not one big stone. It was, they just all happened to coalesce in the
oh,
radiograph. So
that'd be like the worst surprise ever. It's like a bad Christmas.
yeah.
So
It's not, it's not the Christmas you want. That's for
no,
sure.
not at all. So that's
Well,
fun.
anyway, so, but yes, hopefully he'll be a much more comfortable boy from now on.
That's one can only hope.
Yeah, exactly. And then we'll just wait and see what those stones come back as. So
Mhm.
anyway, here's my PSA for today. Watch your dog anytime they're straining to urinate. Make sure you call your veterinarian
Yes, very quickly.
very quickly. We'll probably talk about that in another podcast too.
I'm sure we will with the cat and dog. The we talked about cats yet with your next science?
We did. Yeah.
Yeah,
We
okay,
did.
that sounds right. So yeah,
I
maybe
know it's been
dogs.
like a few pods ago, so it's like, well, I'm sure we'll
Yes.
talk about it again because it's one of those things that you're constantly having to deal with
Yes,
if you
frequent
have enough
flyer.
pets, you will eventually deal with some kind of urinary issue, whether it's a
Yeah.
stone or something else.
hmm
At least a
Definitely.
stone we can fix.
Yes, that's probably one of the better ones. We can clear definitive answer for that one.
Yeah,
So
exactly. So let's get into it with our toxicity. I think a good place to start is something that I think pretty much everyone has in their cabinet. So if you get a headache, you reach for ibuprofen, reach for
yeah,
Tylenol. Go
yeah.
ahead. What do you think of those two?
Uh, they happen all the time, and it's funny because owners just don't realize that dogs will get into them even if they don't taste good, because they don't. But dogs are very indiscriminate eaters, and even if you think it's safe, unless it's 6 feet off the ground, I mean, you've seen dogs get on tables. They're very impressive when they want something, or
Oh yeah.
most commonly it's in your purse. That's probably the biggest culprit, I think, for most people. Dogs get the purses,
Hmm.
and they find miscellaneous medications, which is probably the worst one.
Yeah, when you don't actually know the answer to what it was.
Yeah, because like a lot of people, I don't blame people. They'll have like those Monday through Sunday
Oh yeah.
containers, which
Hmm.
seem like a great idea until your dog gets in there like, well, I don't know if I had Monday through Sunday or Monday
Yeah,
through
like how many did I have
Wednesday.
in there? Yeah.
Exactly. And that gets a little trickier. And as we'll talk about, dosages are really important, like how toxic it is. Because some dogs or some medications, like we talked about with Tylenol, it's safe in certain quantities, but in the
Yeah.
wrong quantity for dogs, it can be toxic.
Right.
So I think
Yeah, and
that's
that is,
one of
I
those
think,
things.
one of those things too, because more and more, just depending on how you're treating certain types of osteoarthritis or things like that, when you have like a long-term treatment, there are some people that do advocate like go ahead and give your dog Tylenol as an
Mhm.
adjunct once you get to a certain point in their treatment. But and most people think like, oh no, that's toxic. I shouldn't do that. And so there is a very small but safe margin where where Tylenol is okay, but only for dogs. Cats cannot
Yes.
process it at all. It is
Mhm.
absolutely fatal, I
Yeah.
feel like, and it's never good. I've not seen a good outcome of a Tylenol toxicity in a cat. Now, you may
Yeah.
have, I don't know, but I have not.
I haven't seen an expensive outcome. I'll put it that way.
Gotcha.
I've seen one that turned out well, but it took them X amount of dollars. It was very expensive.
Yeah.
So yeah, it's definitely not good. If your cat gets into it, it's a huge no-no. And definitely
Right.
call your vet like ASAP.
Oh yeah. And the difference, so we talked a little bit about like lilies, and that in cats is going to be more on the kidney side of things. This is more liver. So if they
Yep.
get into Tylenol, this is going to affect their liver. And so I guess
Mhm.
maybe it's important to know what kind of signs happen when that happens. And so usually it's going to be they're not going to want to eat. They may be vomiting.
Mhm.
Is that usually what you've seen? Because that's usually what I've seen.
Yeah, most others are pretty good about knowing when. I can't say there's many cases, and if there
It's not
is,
that common, no, because cats
yeah,
are not as indiscriminate an eater as dogs are.
thank God.
Dogs are so much more likely to eat something they shouldn't.
Yeah, and most time like we'll know when like either it's like a young kitten always too. It's like
Mm-hmm.
a
Yep.
less than year old that they jump on the counter and they lick it, and all of a sudden licking the medication in most cases I'll say is safe.
Yeah.
Um, that's the one like safety valve I'll say for most things. Most people freak out about it, but I guess the liquid capsules are probably the only exception to that. If they lick a lot of it, but like a quick puncture is most time not going to bother your pet.
Right.
So I guess that happens a lot. Like, how many phone calls I get about punctured capsules where they come in to make them vomit? I'm like, you'll be fine. Go home and that's okay.
That's really funny. I don't get that one a lot. That's
Oh, I get
interesting.
it
But
all the
that's
time because
a emergency clinic kind of thing, I guess.
it's like
The
kittens
one
playing
that
with
I get all
pills.
the time is like people were taking meds themselves and they
Oh,
put it
really?
down and walked away. And that's when their dog
Oh,
got it. So they're like, I don't remember if I took it or if I put it down. That happens all the time. It's like, I think maybe my dog
okay.
got this, but I don't really know. So we'll usually figure
Gotcha.
out because what Dr. Robert was saying is like uh the dose makes all the difference. And that is
Mhm.
true. It's the dose that makes the poison. So you don't know until you know the dose for certain
Yeah,
medications.
exactly. So something just keep in mind. But yeah, Tylenol is definitely a no-no for cats
Mm-hmm.
and within
And
range
yeah.
for
And
dogs.
check with your vet if they got into Tylenol.
Always. And that'll be the summary of this entire conversation. Like if it's any medication at
Yeah.
all, please don't give something off of Dr. Google. How
Oh
many
gosh, yeah,
times
don't do that.
that's caused the problems? Like I cannot emphasize that enough. Call your vet first. Even an emergency clinic anywhere. If your vet's not open, call an emergency clinic. They will let you know over the phone. Oh, they'll tell you we can't prescribe medications over the phone, but at least they'll tell you like don't give that medication either because it's dangerous.
Right.
So
Right, absolutely. And like I this is just like a PSA for me. I don't know if this happens to you very often, but um don't give your dogs aspirin. I don't like that. I know
oh,
people
I'm not a
say
big fan either.
I especially if they've been limping for like a week and you're
Mhm.
coming in to see me today and then you decided to give the aspirin for the first time this morning. Don't do that.
Yes, I agree.
So then
Like
you've taken away a whole like
talking about drugs.
medication class that I now
Yeah.
can't give. And the reason for that is just that aspirin has a longer half-life than like it stays in the body longer than some of the non-steroidal anti-inflammatories like the pain medicine that we would use for our
Mhm.
dogs that we would give you if your dog is lame and it's appropriate, once you've done an exam on them. But once
Yep.
you've given that, now I have to worry about it upsetting their stomach or had them having an adverse effect because you gave some aspirin. So call ahead before you
Yeah.
do something
Or
like
just
that.
wait a
Just
couple hours
call.
to talk to your vet.
Yeah.
You're almost
It's
there.
okay. I mean, if you really feel like they're in that much pain and you need to give them something, call and I'll tell you if it's appropriate or not. Or
Yeah.
maybe you have another medication that's a better choice that you had on hand and I can look back in your chat in your chart and I'll do that. I do it every single day. So call
Mhm.
ahead.
That's probably the best. That's honestly probably the best advantage of having a primary practitioner. So they don't see very often because most of the time they're calling. I have no idea what medications they're on, or they're like, "Well, I have this medication for myself." I'm like, can't really do that over the phone. Like,
Yeah, I
I
don't.
was
Yeah.
like, so the primary practitioners are wonderful people. Talk to them.
Well, we know your pet, and honestly, like if I can save you a trip, if I can save you the time to come in, like we talked about before, we want to help, we want to see you if it's necessary. But honestly, if there is something that I can do over the phone that I can reasonably say, hey, your dog just started limping yesterday, but they're otherwise totally fine. It's totally fine to rest them, and I'll give you some carprofen if it's appropriate because I know them and I have a chart on them and I've seen them in the last year.
exactly. That's the CYA portion of the
Yeah,
podcast.
exactly. Exactly. If I've never met you before, I don't know your dog, I'm definitely not going to prescribe anything for you over the phone.
Indiana, don't come get me.
I know, right? Exactly.
Oh
It's
man, it's
true.
funny. It's a real thing that's like, please don't,
Yeah.
come after
No,
my
we do
licenses.
have to be pretty careful. And I think sometimes people think like when we're like, well, legally I can't like answer that question. I'm not being withholding. I actually can't answer the question if I say
Yes.
I can't. So
Yes.
we do try to be helpful when we can.
Mm.
But so ibuprofen. So why don't we talk a little bit about what you see when you see one of those, what the course of action is for you when you generally see an ibuprofen toxicity?
And most times a dog got into a significant quantity of it, like they eat the entire bottle for some reason.
Because
And I don't
maybe
know
the
why.
coating is sugary, because that can happen sometimes
Yeah.
too.
And that's the problem with the doggy version of, I guess, would you say carprofen is probably the doggy version of ibuprofen, like the
Oh
one we
yeah,
use most
yeah,
commonly.
yeah,
Carprofen or Rimadyl for those who have it at home.
yeah. Or I
Most
mean, it
times,
comes
like they
now.
taste
Now
good.
they have so many like there's Truprofen, Novox. Like there's like a
Oh
so
yeah,
there's a whole bunch of different. But
varieties.
carprofen is the drug name, and yeah, that's probably I'd say one of the more common. That's the
Mm-hmm.
most common one I think of
By far, and that's
usually.
probably the one I see the highest toxicity with as well.
Hmm.
And those two ibuprofen, the reason I bring it up is because they're both very similar
Yeah,
in terms of what they cause. It's GI upset, gastric ulcers, kidney issues, so things that are very serious. But dogs tend to like them because they do taste good on the outside, and they'll eat a significant quantity of them. And
well, they
whenever
also
you're
come
coming,
in a flavored tablet. So that, I
yeah,
mean, it's meant to make it so that it's easy to give it to them. But then, of
yes.
course, that means if they get into it, they'll want to eat the whole bottle. And that's where we
Mm-hmm.
come into a problem.
And so it's really important in those situations, like when you do notice your dog eats those things, one, start going to your vet, but two, bring in the bottle so we know like what the milligrams of the medication was given, how many were actually in there, because we're always going to play worst case scenario with you in terms of asking, if
Yeah.
there's 90 pills in there and you know you only gave at least 10, well, then my number is 80, and that's what I'm going to treat your dog for in terms of the number of tablets they ate.
Yeah.
Um, and because let's say your dog's not showing signs yet, maybe I don't need to puke them if they only had 3 or 4. But if they had 80, then yeah, we're going to puke them and hospitalize. And there comes very different treatment plans and very expensive ones, depending on how many. So it's really important. Like if they eat something, grab it all, and go from there.
Yeah. And I would definitely say, like, when it comes to any medications, if you could just, have them up high where they're just not going to be able to get them behind a door, anything like
Mm-hmm.
that, as much as you can. And I mean, we're all human. So sometimes we leave things out. But especially if like, I mean, I have a lab, so he eats
The garbage
everything.
disposal of the dog breeds.
He does. I mean, I didn't even realize he could get on my counter, and then I made a sandwich and I walked away for a minute and I came back and I was like, "Where's my sandwich?" And Gus is like happily
Delicious,
licking
mom.
his
It's great.
chops. I'm like, "Oh, you stinker!"
I
I
feel like they
was
always
really
do it the worst
hungry.
time too. It's like it's always the worst
Yeah,
time. Like I'm starving, and the one
yeah,
time I did that, Logan came by and ate like a peanut butter and jelly sandwich off the counter, and I love peanut butter and jelly. Like I don't
yeah.
get a chance to eat it enough, but it's just a
So
good
good.
classic sandwich.
Yeah.
And the one he hasn't done this in 10 years, but the one time I was starving, I made that sandwich. I turned around for 15 seconds. I come over and the plate's on the ground, and I'm like, "You're an asshole." I was like, "I'm sorry."
Yeah.
Like
You're like,
I was so hungry for that
why?
sandwich. So yeah, dogs, even vets, dogs are a pain.
Yeah. Oh yeah. Actually, our dogs are the worst.
Yeah, there's a reason
Always.
Loki has his
They're always
name.
gonna have the most issues. Like
Yeah, either
it's a
like
foregone
physically or
conclusion.
emotionally. Yeah, they're just no little
Yeah.
nightmares for plenty of reasons. So
Yeah. Yeah,
I don't know.
exactly. I'm not sure if it's because like we recognize everything or like we over worry about all the things or it's just like luck of the draw. Like, of course, you're
Or we
gonna
feel
have a
like we need to
lemon.
make them better dogs because we are veterinarians, so people judge us for them because we're like, oh, vets, you should have a really good dog. It's like you
Yeah.
would think that.
You'd think that, but
So I
no.
don't know. No,
My
not
my
not a,
pandemic puppy is every bit a pandemic puppy. Even
oh
though I
god.
did like I tried to socialize him so well. He was always, actually he is very sweet. I really can't complain about him.
Oh,
He's actually really
he's very sweet.
he actually
So
is a very good dog. He has like odd cues sometimes, like he'll bark at people, but he'll be wagging his tail. And I'm like, you
oh.
can't be doing both of those things. Like he'll be like, like he doesn't know like
Everybody's like,
how
oh,
to
your dog's scary.
respond. And it's like, I'm not, is he like gonna eat me or does he want me to pet him? Like, I don't really know what to do here.
It's a fine line, and who wants to play
Yeah.
that game? Like,
Yeah. Like, I'm not gonna play, Russian roulette with your dog's mouth. Like, I'm not gonna do that. Yeah.
well, I felt bad. I had a coworker the other day that asked me about. They're like, "Hey, my dog's starting to be more aggressive with people in the house." She's like, "Oh, like I want to nip it in the butt before it gets bad." It's like, yeah, no, that's fine. Like, we can start some medications and then work on training, like using both in conjunction. You mentioned take away some of the medications. I was like, a friend you can trust that like you walk into your house and like kind of be the devil's advocate or Russian roulette person goes like, you got to start testing a little bit and see what the trigger point is. And I was
Yeah.
like, I wouldn't want to be that friend. Like, you got a big
I'm
scary
not gonna
dog.
do it, but I'm just telling you what you need to
Exactly. It's like,
do.
so good luck. We'll see you
Yeah.
later.
Oh, speaking of which, behavior modification drugs. So
Oh,
people take those as well as dogs, and that's probably one of the most common things that people call me about.
mm,
Um, is that they are taking some form of medication, whether it be Zoloft or Prozac, Wellbutrin, whatever it is. And there is a
yeah,
good
yeah,
handful of those that we actually use for
yeah,
dogs.
yeah.
Some
Ritalin
of them we
even.
don't.
Yeah, yeah. I'm trying to think. Yeah, we don't use we like fluoxetine. Like all those are the ones we do use for
So
dogs quite a
fluoxetine,
bit.
for those of you who don't know, that's
Nice.
Prozac.
Yes, Prozac for. I'm so bad with the brand names. Honestly, I only know generic.
That's
I'm.
because in veterinary medicine we can't afford the real stuff, so we always get the generic. So
I
we
always have
don't.
to look them up.
I don't. I know. I my whole family are human doctors, and they always call everything by their name brand. I'm like, what is that? And then they'll tell me.
Mhm.
I'm like, oh, okay, that's
I'm like,
this thing. I'm like,
that's the generic. Yeah.
for those of us that can't afford the flagyl, we use metronidazole.
Yes, exactly.
Yeah.
We're not too bougie in veterinary medicine.
Yeah. No. No. Not at all. Not at all. We do try to save people money where we can, and
Yes.
use the generic.
Mhm.
So anyway, what do you see with those? Because I will say, actually, I've gotten pretty lucky. Most of the time people call, they know what their milligrams are, they know what they're on.
That's
And
nice.
I knock on wood, when I do the math, it's usually like, okay, that's not gonna be a toxic dose. Like it's gonna be okay. I've been lucky with the psychotropic meds.
Yeah, I'll say for the most part, yeah, every once in a while, have one dog that eats their own medications. More often that we'll get phone calls that like the dog, let's say the male or female owner, because both make mistakes, will give the dog like the PM medication in the afternoon, and then the other owner gives it too because they're like they didn't know their partner gave it,
Right,
and then they'll call about that. And usually that's a safe situation. Like most time that's not a big deal. Or they'll miss a dose and they're like, is that a problem?
right,
Those usually aren't huge concerns, but when they get into the kind of very similar. They get into someone's purse or someone's stash of medications and they eat all of them at one time.
right,
That's obviously a little more concerning. You see anything from severe sedation to like hypersalivation. Those are probably the big ones you'll see. Vomiting, like GI signs are all pretty much. It's tough because vomiting is very non-specific. It can be pretty
Oh
much
yeah.
anything.
Yeah.
Um, most medications will cause vomiting of some sort just because they cause upset stomach. So
Mm-hmm.
it's tough to be like, hey, which pill did they get into based on this? It's like that's hard to say, but
Yeah, you're like, I don't know. It's like,
yeah,
give me a list of all of the things you're on. I'm gonna
mm-hmm.
look at the interactions between them, and I'm gonna look at like worst case scenario, which one of these we have to worry about. At least that for me,
Yeah,
that's kind of what I do.
same thing, 100%. And yeah, but like the sedation probably is the one differentiating factor because of a lot of those because it'll make them a little more sleepy in a lot of cases, or like very dull.
Mm-hmm.
Um, so that kind of helps a little bit. But yeah, GI signs alone are not helpful, not as much as I'd like them to be.
Yeah. And I think like just be aware of what you have in your house. And
Mm-hmm.
maybe if you have people like living there, like you have like young, like teenagers, or you have, just like be aware of everybody's drugs if you can, if you have an elderly
Mm-hmm.
family member, because a lot of times they're on either a blood thinner or they're on, which yeah, we can you can use those things. I mean, there's plenty of times
Okay.
where we have, dogs that are on the same sort of medications, or cats. Oh yeah, I guess cats too. You
Yeah,
put a girl or something like that.
yeah,
But like, you have them on medications, but the dose is going to be wildly different. And so I
yeah,
think that's the biggest thing. And then if you can give us a list, I mean, just know what everyone's on in your house. Especially if you know you have a dog that gets into things, that would be my
yeah.
my thought on that.
And I think along the same line, something that we see pretty commonly is like owners will know they spilled their medications and they'll see their dog around it. Um, and they don't know how many they got into.
Yeah.
And so first, before you like freak out, first count your pills. Like take a second, look underneath things. So we have people bring their pets in, and all of a sudden, like they panic. They just grab the dog and they run them right in, which is not a bad thing to do. By all means, like it's not a bad idea. then they get home afterwards and realize the dog didn't actually eat anything.
Mm-hmm. That's an
So like
expensive thing to find out after the fact.
exactly, because like we induce vomiting and all that stuff, and it's like $300 or $400 later. It's like, oh, we got home and we found the thing we thought they
All
ate.
the pills. Yeah. Yeah,
So like
exactly.
sometimes take a second, like look around, count all the pills, like the
And also
five
call
minutes it
ahead
takes you
and
to do
make
that won't
sure
take.
it's one of those things that like
Mhm.
you need. Usually you have a minute. Like if you, especially if you just saw them do it, you're like, all right,
Exactly. Like
it's not
the
going to process that quickly.
exactly. That's the biggest thing. I think like you have 5 minutes to take a look around. Don't wait half an hour, hour. Like some people like came in 8 hours later. I'm like,
Well,
maybe a
now
little
it's
sooner
too
than eight
late.
hours. Yeah, now it's
Yeah.
now it's still late.
Yeah, yeah. You're like,
But
not much
most
I
of the time,
can
take a
do
look.
now, but yeah, yeah. And so I think, I mean, that's pretty much the take home with medication, which is kind of why we were
Mm.
like, well, we probably can kind of move on from there and maybe go on to something like xylitol, which is in
A
food,
lot of things.
especially it's in
A
a
lot more
ton
things.
of stuff.
Yeah, I
Yeah.
was kind of surprised. I didn't realize how many. I think probably what do you most commonly associate it with?
Gum.
Yeah, and
I
that's
mean,
probably most common. Yeah,
that's usually where, because that's what you're saying about the bag. Like people usually have sugar-free gum in their
exactly.
purse, and then their dog goes in there, eats all their ibuprofen, and chews their gum.
Well, because smells like my dog loves gum. Like it's just like
Because I think that like the like
the
minty
mint.
smell is,
Yeah, that minty
yeah.
spearmint. Like even when I'm chewing gum, like he wants to be right in my face. He's like, "Oh, this is the best day ever." I'm like,
Like no.
"Personal space, love
But
it."
also too, I think with like keto being a really big thing and like people
Mm,
not wanting to be like eating a lot of actual sugar,
yeah.
xylitol for people can handle it, it's no problem. But in dogs, they don't process it properly and their bodies like their blood sugar tanks.
Yeah.
And so it's really, really dangerous for that. It's fatal if you don't know that they got into it, they can
Mm-hmm.
die.
Yep. Yeah, that and can cause liver failure afterwards. Like it can be rough. So it's definitely, and now they have all these baking products. I think, yeah, like you mentioned with the keto, like
Hmm.
things I didn't realize, like certain,
Peanut butter. You have to be really
right?
careful.
That one threw me off one time. I didn't know like peanut butter threw me off. And there was some baking dessert that someone brought in that had a truckload of xylitol in it. I was like,
Yeah.
I honestly didn't know. So there's stuff even that veterinarians don't know. I'll be honest. Like there's so many things that are because people are trying to be more healthy, which is great,
Yeah.
all for it. But I'm a terrible cook in the first place, so I'm not gonna know what's in half the things that you're bringing in. So
But
sometimes you have to give
I
a
still
second.
like will call ahead like if I'm getting meds like a human medication in like a syrup or something.
Mm,
I ask every time. I'm like it doesn't have xylitol in it, does it? Because you never know if
smart.
they're going to change the formula or something and I for years and years and years I'll call in Biomox or whatever and then it's like all it takes is one time for them to change that and then now I have a puppy that just couldn't handle the hypoglycemia to begin with and
Yep.
now here we go and so I always double check because I'm so nervous about it.
No, I think it's great. Now, and that's also like a additional point for human medications. Like some human medications have xylitol in it. So a reason not to give your dog that medication is because it has xylitol in it. I think gabapentin is one of them.
Gabapentin, yeah, liquid
Um,
gabapentin.
yeah, so just
But
don't
I
give your
think you
dog.
can give it to cats and they don't have it's not the same. It's dogs really, it's not cats. Isn't that true?
Honestly, I never seen it, so I can't give you an honest answer. I don't think cats have the same issue with it.
I don't think they do either.
Yeah,
Well,
because I haven't seen
stay
it. So
tuned. We'll update you on that one because
yeah, I
I'm
was gonna
pretty
get back.
sure that they don't. And because
I think you're right. I honestly don't know. Cats
yeah,
don't do
and
dumb
like
things.
we see the thing is we have it compounded in a liquid, so I don't ever use the human one, so I don't actually know the answer to that. But
Yeah,
because I give gabapentin to cats like it's water, but
as we
it
should
helps
because
keep
they're
them calm.
much nicer. So like it's
Much nicer.
literally night and day. It's crazy how much that medication
It's
helps.
amazing. It's such an amazing medication, and
Mm-hmm.
like it's so well tolerated. And even for some of
Yeah.
my really old kitties that really can't tolerate like a non-steroidal anti-inflammatory for their
Mm-hmm.
arthritis. It seems like gabapentin makes them so much more comfortable. Like
Yeah, I
lower
agree.
doses, lower doses.
Yes. Yeah, but
Yeah,
they really do great on it. I'm actually quite happy with that medication as a whole. It's like
I am too. I think it's
so
a pretty big game changer. I hope that
mm.
that's not really that much of a change because it's been around for a while, but
Its utilization has changed.
yeah, yeah, I
Honestly.
think it's
So I'll
definitely
say that.
picked up.
So
I feel like you used to like see a huge wave of more people using it, a lot more specialty clinics like things come back with it. We use a ton
mm.
of it. I love it. I really like gabapentin a lot.
I'll even give a shout out to the primary practice field in general because a lot of them actually send their owners home with it just because they know their cats are very, very angry and have actually owners give that medication before they come into the ER clinic, and it is a lifesaver. So
Oh
Thank
yeah.
you to all those who are listening right now. I appreciate you. You have no idea how much.
Your hands appreciate
Yes. Well, like
your face.
I went on a date the other day and they looked at my arms like, no, I just had a bad cat the other day that just lacerated my arms.
Oh
So,
yeah, I got one. I got one today. I don't know if you can see it. I got
oh, yeah, because yeah, very,
yeah,
yeah, right.
I got a gash today.
Yep.
I
They
cleaned it
just,
extensively.
oh
So
God, it,
hopefully nothing will happen. But it was a back claw too. I didn't see it coming.
it's the claws, man. They get you, and they once they get in, like that's literally the worst. Like almost worse than teeth, because it's like
Yeah, and then
they
sometimes
can't even get them out.
oh yeah, and then you're like, ooh.
Yep.
It's
It's
not good.
Yep, one of the marketing videos that I had to change from using, you'll see it shortly, myBalto community.
Yeah.
But it's me running on a treadmill with a dog. There used to be a cat in that treadmill, but the cat was not tolerant of the treadmill noise and tore up my hand because of it. So,
So that
um,
was no longer going to be part of it.
yep, that's why the cat got replaced with a dog. So, anyway,
um so yeah, so that's the word on xylitol. Just be real careful with that and definitely make sure, just
mhm.
like don't even hesitate. Your dog gets into something with xylitol, have them seen
Yep,
right away.
100%. And I think
How quick
they'll,
is it? I've never actually had one. I've had school
I think it's within
one.
4 to 6 hours you'll start seeing signs of like low blood sugar.
Mm-hmm.
And then after 24 hours it's like 24 to 72 you can start seeing signs of like liver damage.
Okay.
So that's why we'll check blood work like every 24 hours, and if they do have low blood sugar, there's a higher concern for liver damage.
Yeah.
So that's kind of like things we use to correlate with the two.
Huh. Okay. Yeah, I've actually just never had one. I know it's toxic, but thankfully, knock on wood, I've just jinxed
It's
myself. You know what'll happen Friday? Is it a full moon?
I never well, there's a real thing. We're gonna take a podcast about full moons at some point because that's
Yeah.
so real I
It
can't
is
even tell you.
so real. I don't know what it is, but yes, it's very real.
You know,
Full
those
moon.
cats
Yeah.
blocking or animals eating things. It's uh, me, my mom, and I don't get along on full moons. It's a real thing. You can ask her about it. It's a real like we won't
You're
hang
like, we're
out on
having a
full
fight. Is
moons.
it a full moon? Let's talk again when the moon's
It's
done.
really true though. We'll be like, why are we so angry at each other? It's like it's a full moon. It's like, oh, that's why. I'll talk to you next week. And
Yeah.
that's how we
You know
handle
that
things.
you can actually get the like phases of the moons on your phone. So you should probably just
Really?
have that. Yeah, yeah,
I'll
there's
actually
an app.
download that right after this podcast because that will
I
save
have
me
because
so
when things
much.
are crazy, I'm like, I need to know the phase of
Yes,
the moon is
you
right
find
now.
out. Oh,
It's
that's
really
funny.
true.
I'll tell you what.
Okay, well then let's get to the rat poison. That's always a really fun one.
Yeah. Do you see a lot of it at your?
I do, and
I okay.
and I've only ever, thankfully, knock on wood, seen the bad one.
No,
One time, the bad one.
I said,
So
here's which one's the
generally,
bad one for you.
yeah. Well, to me, if you can treat it with vitamin K, I don't consider it the bad one.
True, I agree. Most unless it, yes, I agree. That's not the bad one. So I'll give you
Yeah.
that.
I every single time, this is a total confession. I have to look it up every single time. I always
Mm.
confuse them. So every single time somebody comes in, I'm like, bring me the box. I need to see the
Yes,
box, and do that every time and
I think
try to
it's really
know how
important
much you
though.
have. Yeah.
Well, because I think there's so like just for starters for the audience, like there's so many different types of rat poisons in general, and they fall into like usually three broad categories.
Mm-hmm.
But there's first and second generation ones. There's just so many different names. So yeah, so veterinarians will oftentimes have to look it up or like find out which one. You telling them that it's a green block doesn't necessarily always tell them what it is. So it's really important to bring in the bag if you can, because they'll help narrow things down pretty significantly.
Mm-hmm. Yep. And so maybe go through all three.
Oh yeah. So pretty much there's three main categories. One is a bleeding disorder one where you eat it and it'll cause you to start bleeding out, which is no fun. It usually takes about 3 days for that to happen, because of how it interacts with vitamin K.
But if you know that your dog got into it and you get them on vitamin K, they'll do just fine.
Easy fix. It's like
Easy
that's what
fix.
Sam was talking about. It's like super
Yeah.
easy fix. It's
So if it's
great.
that one, I mean, I'll still check,
Mhm.
like their ability to clot. There's a profile you can do and you can check it,
Mhm.
make sure that it's normal, but I'll put them on
Yeah.
vitamin K.
Yeah, it's a nice easy one. So that's the
Yeah.
bleeding one. There's one that affects your calcium, vitamin D. It's a vitamin detox or vitamin detoxicity, right? No, not sorry. I'm thinking of it's cholecalciferol. I know the
Yeah,
drug,
yeah. And I was like,
and
come on, you can say
no, it's
it.
cholecalciferol. But it affects your calcium, essentially, and
It's
phosphorus.
that one and the CNS one are the like two really bad
Well,
ones.
bromethalin, yeah, is the CNS
That's it,
one.
bromethylin. Every
Yeah.
time I always have to look it up.
That one I see. So they're actually. So I'm curious on your end of town. Are they? So they're actually getting away from the anticoagulant ones for supplying them in California. So like we don't see them as much anymore
Yeah.
because they're all moving to bromoethylene, which is like the worst one to
The
move
worst
to.
one. There's
Yeah.
nothing you can do about it.
No, it's literally
Because
just
the
hope you get them to vomit.
cholecalciferol you can. There's that medication you can give, right?
Yes, yeah. So you can treat the
Yeah.
cholecalciferol one, but you bromethylene, you just have to hopefully get them to vomit up as much as you can, and then
And then
wait. And
support them and make
yeah,
sure that, yeah, but that what it does is it makes their brain swell.
hmm
It's
yeah,
awful.
yeah. It's like seizures, tremors, dull mentation, and it can happen. The tough part is they can happen like immediately, or it can happen over like a 2 week span. So it's always tough sending owners home with that because they're anxious for like the next 2 weeks, being like, I don't know. And I'll be honest, the 2 weeks one I think is a little more chronic. Like dogs are eating a little bit each day. We tend to see that a little bit more with the chronic ones, but
Oh.
um, yeah, overall, like it can take a while to show up, which is the scary part. So owners are always like on edge for a couple of weeks.
I somehow, even though I keep hearing that like they're not really going to be making as much of the is it warfarin then that's in the
Orphans,
other
yeah,
one?
that's the
Yeah.
anticoagulant one, yeah,
Yeah, so
or anti-bleeding. Sorry.
yeah, right. So like that so I keep hearing like they're not going to make those as much, but like
Mm.
historically that's the one that I've seen the most, thankfully, and then I can
Yeah.
treat it very easily, vitamin K.
Mm.
Um but it's you keep hearing that it's just going to be more and more and more of the other ones. And
Yeah, the bromethylene
I've
one. It's
only ever seen one bromethylene, and thankfully, I don't think the dog got very much.
that's the so it's important to talk about too. So like
Mhm.
we always talk about dosages with toxicities. That's really important. A little bit like your dog needs to eat it. Depends on the size of your dog, but like it's really important to like see how much they ate. Them just taking that small, like having it in their mouth will not cause any problems.
Mhm.
But obviously when they start ingesting it, then we start being concerned. So just trying to find out how much they ate. A lot of times it's usually at a neighbor's house. I'll be honest with you, because like most people know they don't have rat poison in the house, but they go to a neighbor's house or their parents' house and they have rats. They put out a whole bunch of rat poison, and they find out their dog comes carrying this big green block like a treat, and they're like, "What is this?"
Right.
And then the panic ensues, and so that's when you want to find out like how much is around the house, what blocks there are. Like it just those that information is really helpful for your veterinarian because that'll help narrow things down.
Yeah, and I also think too, like a mistake people make is like just because they didn't put it someplace that they think is accessible to the dog, like they move it. Mice move it to
Mm-hmm.
other places. So it can become accessible. So if you know you have it, just because you didn't put it someplace they could get doesn't mean it doesn't get someplace that they can get to. And
Mm-hmm.
so you should be aware, like you know you have it, it's still a potential toxicity for them, even in your own house. Or if
Yep.
you just move to a new house, maybe just
Oh,
like
that's
if
a
you
good
know you
call.
have pets, like because I just moved to a new house, so like you discover all sorts of new things in new houses. So just
Yeah,
make sure
not just
that
ghosts, but no I'm kidding.
just make sure though that you that you check and see.
Yeah.
But for sure they move it. So it doesn't always have to be where you think you put it.
And then a lot of people also ask about my dog ate a rat. Do I
Oh
have to be
yeah.
concerned about them? And the nice thing is no.
Yeah.
Like they eat such a small amount that your dog can eat the rat. It'll be fine.
Hmm.
So don't have to worry about your dog or cat, or I guess cats. You don't have to worry about
Eating
them
the
having
mouse
issues.
that ate the rat poison. Yeah.
Yeah. So don't have to worry
Yeah.
about those things, fortunately.
Yeah. But definitely, I mean, I don't know. I always I feel like if you have pets or you have kids, maybe don't use rat poison.
No,
Just
just don't. It's just
yeah,
use
get
the
traps.
traps. There's just no kill traps, which are great.
Yeah, they work and yeah,
Yeah,
that's what I
sticky
would do.
traps. There's a whole
I
bunch of
mean,
them. I had a problem with it in
yeah.
college, so I'm very well versed in the trap issue. So there's options.
Yeah, my
So
second apartment in Manhattan was
sure.
it wasn't
That's
good.
funny. Nice.
I actually ended up moving out. It was so bad.
Oh, see, there you go. It's
Story for another
well,
day, but
yeah.
it was like on the first floor between two restaurants in Manhattan.
Oh, that's
There
asking
was
for
no
trouble.
stopping the mice.
Yep, that's the problem. That's I think the most time I've seen mice out here in San Diego is like the outdoor restaurants, which are
Yeah.
great. But the mice have like their own little nest near the garbage cans. So like this is the best place to eat in town.
Oh yeah, I
So
know. Like if only Ratatouille was real and like they could just like
it's such a cute movie though. I
it's
love
such a
that
good
movie.
movie. I
It's a
know.
really cute
I
movie.
know.
So
But then you like think about it, you're like, oh, but really that's disgusting.
I know, right? But I love. Well, one day we'll talk about rats as pets. One day, maybe as a podcast. Because
I
honestly,
love rats. Rats are
they're
great.
they get such a bad bad knock. I think because of one, they are feeling like being dirty, but also mice are not as cool as rats. I'll be very
No,
clear
not
about
even.
that.
They're not as smart either.
No, not at
Rats are
all.
smart. They're trainable. They're
Hmm.
really sweet. They're very social. I love rats. Rats are
Yeah.
great. Not
Did
New
you have
York
any growing
City,
up?
like no,
Oh no. Okay.
but when we were in school,
Mhm.
one of our friends
Oh
adopted,
yeah.
yeah,
Forgot about that.
adopted two of them.
Oh, I forgot about that entirely. That's cute.
Yeah, I mean they didn't live very long because they don't live very long in general,
Yeah.
and they had been like there were research rats, and
Yeah.
then they adopt them out when they're done doing their research, and so one of our friends had two of them.
Yeah. I remember that now.
They were
That's
so
cute.
sweet.
Very cool. They're
Scuttle
cool
and
rats.
Sebastian, that's what she named them.
Oh, your memory is really good. That's
Every once in a
doctor.
while.
It's like, so mine apparently isn't. So I was like, I don't remember the
Yes,
names
I'm
that
very
well.
good at remembering things that really don't matter very much.
They mean a lot to her. So that's
Oh,
important.
well, yeah. But they were really, really sweet rats. They were really
Yeah.
good.
So get
Yeah,
a rat
no,
one day.
those are
If you
good.
don't want to jump towards a dog or cat one day, get a rat first.
Well, yeah, especially because pretty soon my kids are gonna make me get them a guinea pig, which means
See, how
we're
do you feel
getting
about that?
two because oh,
I
I
just gonna
love
ask
guinea
that.
pigs. I mean, to be
Okay.
fair, I grew up, I had guinea pigs, I had ferrets, I had
Oh, you have
rabbits,
ferrets too. Okay.
oh yeah, I had two ferrets.
We're definitely doing an exotics podcast at some point,
Yeah,
and like we'll have
we'll
you do
talk
most
about
speak
it.
on that because I've only had rats and my dad had ferrets once upon a time, but
Yeah.
um,
All right, well,
there's
stay tuned. We'll talk about pocket
uh,
pets and
pocket pets.
exotics and yeah, I'll let you into the little world of my kids trying to earn a guinea pig because that's what's happening right now. They're trying to prove they're responsible enough to have a guinea pig. And I'm like, okay, it's really going to be
That's
my
smart.
guinea pigs, which
Oh
is
yeah,
what's going to happen.
that's always
I'm
how it goes.
fully
But I
aware of it.
appreciate the ambition though. They're smart. Start small.
Yeah, they're trying. They're trying really hard. They're angling. They really want one. And then my
Yeah.
son's like, "Well, then I want a blue fish." I'm like, "Okay, you can have the
It's
blue
probably the
fish.
best
That's
deal there.
no problem.
Yeah, it's like
That's
that's
fine."
equally the best deal.
Yeah, because originally he wanted a bearded dragon, and I was like, "Okay, well, can we go slow?" He's 4. It would be my
Oh,
bearded dragon.
it's yes, it would 100% be yours.
And
So
they're cool. I have no problem with that. We can talk about that another day too, but
mm,
so that's for another podcast. And I think we should maybe, kind of button things up. So basically,
oh yeah,
the most important thing when it comes to toxicities really is just going to be call your veterinarian.
yeah,
If you're not sure, don't wait. I think the biggest mistake people make is my dog ate this at 7 o'clock last night and it's the next day and they want to
yeah,
know what to do. You waited too long. Don't wait that long.
yeah.
Make sure that you call. Try to call as soon as you notice because
Mm.
you'd rather get the answer that, hey, that's nothing to worry about, or bring them in right now.
Exactly. Yeah. Call, keep track of what they ate, how much they ate, bring the packages in. That's pretty much a good golden rule for all stuff. Just bring the package in, try and figure out how much they ate, and take a second to look around.
Mm-hmm. Yeah, absolutely. So we will be having our next podcast.
That's a good
We
one.
thought maybe we would talk a little bit about euthanasia, actually, kind of like a bit of a rougher subject, maybe, but I think a really, really important one and one that everybody that has a pet is going to deal with at some point. So I think it's a
Unfortunately, yeah.
super important one. So we decided we'll tackle that next time.
Yeah, that'll be good. I hope you guys all stay tuned for next week and all the weeks, obviously, because Sam and I are awesome to listen to. But
We're so
just in
fun.
general, we're so much fun.
Yeah, I know.
But
I'm
just
like,
enjoy what
I
we're
don't
doing.
know. We'll try not to make it, too sad of a podcast. It'll still be enjoyable, but I think it's a really, really important topic. So we'll make sure that
Yeah.
we tackle that. And if you do have any burning questions, any things that you really want to know, Robert, why don't you mention the email?
You can send them all to was it now podcast at mybalto.com. And we'll be happy to look at them and get things going.
All right. Well, it's been lots of fun. Thanks, Robert.
Always.
All
Thanks for hanging
right.
out, Sam.
Yeah, absolutely. As always, you've been listening to the Pawsit podcast. Thanks again.